Good morning, everyone. This is Karl F Rose recording from Bedford, Pennsylvania on Monday, October 5th, 2020. And before we get going, let me put on my music here. Okay, now let me get into my disclaimer. Let me do this. Okay, if you're 13 years old or younger, please leave this podcast now. This content is not directed for children or not targeted for children in any way, so again, please leave now if you're under the age of 13. Okay, good morning, everyone. Again, this is Karl F Rose recording from Bedford, Pennsylvania on Monday, October 5th, 2020. And as many of you know, there was no podcast last week because I was in the hospital. There's a lot to talk about, and it's going to take me about 2 or 3 podcasts to go over the whole thing because basically everything is a mess. But I'm doing better. I just want you to know that. Got some things figured out. But the bottom line is because of all the variety of medicines I take for the number of medical conditions I have, it's turned out that I have Serotonin Syndrome. This is something that Dr. Phil talks about a lot. And mainly it's due to like a lot of people with drug addictions or things like that. A lot of people like using methamphetamine and stuff like that and having a lot of things like that. Let me say for the record, I've been 31 years straight from any illegal drugs, and I have been alcohol free for 13 years now. So get that out of the thing, but out of the record here. Anyway, what I want to talk about is the serotonin syndrome itself, because I have diabetes, I've got Raynaud's disease, I've got hypertension, I've got cervical dystonia, and just a number of things. So the problem resulted in, and also I've got major anxiety disorders and major depression as well. And the problem is with all these medicines going on, it causes a lot of excess anxiety and stuff. And the medicines that I was taking was not addressing the anxiety. And I had a number of other issues going on outside of my, the doctor thing. That's going to be for another portion, another segment as to why I ended up in the hospital, because a lot of outside things influenced and just kind of magnified the problem. So I'm trying to keep this as short as possible, but let's just go over this serotonin syndrome, because I don't want anybody else to ever have to go through this. So hopefully I can share these warning signs, because if any of you are like me and you're taking a number of medications, this could very easily happen. It's almost accidental, but if you catch it in time, you won't have to end up in the hospital for a mental evaluation for 5 days like me. But anyway, let's go with the overview here. It says serotonin syndrome occurs when you take medications that cause high levels of chemical serotonin to accumulate in the body. And that's what was happening with me. Serotonin is a chemical your body produces that's needed for your nerve cells and brain to function. But too much serotonin causes signs and symptoms that can range from mild, shivering, and diarrhea to severe muscle rigidity, fever, and seizure. I didn't have the seizures, but I had the other stuff. Severe serotonin syndrome can cause death if not treated. So, in a way, it was absolutely necessary for me to go in the hospital, because I was I was going down the drain fast. I didn't really realize it. Milder forms of serotonin syndrome may go away within a day of stopping the medications that cause the symptoms, and sometimes after taking drugs that block serotonin. Symptoms. Serotonin syndrome symptoms usually occur within several hours of taking a new drug or increasing the dose of a drug you're already taking. Signs and symptoms include, now pay attention, because if you have any of these and you're taking a number of medications, talk to your doctor. Actually, and if you have a psychiatrist, talk to your psychiatrist, not your general practitioner. You need to see a psychiatrist on this. Signs and symptoms include agitation and restlessness, confusion, rapid heart rate, high blood pressure, dilated pupils, loss of muscle coordination or twitching muscles, muscle rigidity, heavy sweating. I had all of those, okay? And I didn't know what was going on. I had no clue. I just thought, and then, then it goes on. Okay, then it says, all right, what's this? Diarrhea, headache, shivering, goosebumps. Okay, severe syndrome can, okay, I'm fumbling with my papers here, but whatever. Severe serotonin syndrome can be life-threatening. Signs include high fever, seizures, irregular heartbeat, unconsciousness. I didn't have the severe, those things. When to see a doctor. If you suspect you might have serotonin syndrome after starting a new drug or increasing the dose of drug you're already taking, call your doctor right away or go to the emergency room. If you have severe, rapidly worsening symptoms, seek emergency treatment immediately. And yeah, I can't emphasize that more. Causes. Okay. Excessive accumulation of serotonin in your body creates symptoms of serotonin syndrome. Under normal circumstances, nerves in your brain and spinal cord produce serotonin that helps regulate your attention, behavior. That was my biggest thing, and body temperature. Other nerve cells in your body, primarily in your intestines, also produce serotonin. Serotonin plays a role in regulating your digestive process, blood flow, breathing. Although it's possible that taking just one drug that increases serotonin levels can cause serotonin in susceptible individuals, this condition occurs most often when you combine certain medications. Exactly what I was saying in the beginning of the show. For example, serotonin syndrome may occur if you take an antidepressant, which I do, with a migraine medication, which I don't. It may also occur if you take an antidepressant with an opioid pain medication. I don't take opioids. I've expressly requested all my doctors that I do not take opioids. I don't want them. Another cause of serotonin syndrome is intentional overdose of antidepressant medications. I did not do that. A number of over-the-counter prescription drugs may be associated with serotonin syndrome, especially antidepressant. Illicit drugs, I don't do illicit drugs. As I said, I'm 31 years drug-free. And dietary supplements also may be associated with. Now, my doctors know all my over-the-counter stuff, and they're making sure that none of that interacts with it. So we're okay with all the over-the-counter stuff that I do. Drugs and drugs and supplements that could possibly cause serotonin syndrome include selective serotonin inhibitors. Here's some of the ones that because I'm on new medications now, such as Celexa, Prozac. No, I refuse to take Prozac. Paxil, which is what my psychiatrist that's one of the new medications, and they wanted to make sure that that's why I was in there for 5 days, to make sure the Paxil was working right, that it wasn't causing any effects. So that was one of them. Serotonin and SNRI, refine, I can't pronounce it, antidepressants such as Cymbalta, Grazamyl, Sprinkle, X4. I don't take any of those. So bupropion, Zyban, Wellbutrin XL, an antidepressant and tobacco addiction medicine. No, I don't smoke. Never smoked, so I don't do that. Tricyclic and antidepressants such as amitriptyline. Yes, I do that to offset the clonazepam. And Pamelora. No, I don't take that. Monoamine oxidase inhibitors, MAOIs, such as isocarbioxide, Marplan, and Nardil. No, I don't take those. Anti-medications, such as Tardol, Carbidol, others, Depecanine, Emerge, Imnex. No, I don't take any of those. Pain medications, such as opioid medications, including fentanyl, hydrocodone, Demerol, oxycodone. I don't take any of those. Lithium, a mood stabilizer. No, I don't take that. Illicit drugs, including LSD, ecstasy, cocaine, and amphetamines. No, I don't take any of those. Herbal supplements, including St. John worts, ginseng, and nutmeg. No, I don't take those. Over-the-counter cough and cold medications containing dexamorphan, I do have cough and cold medications in my medicine chest in the bathroom. I'm going to have to check those, and if they contain that, I'm throwing it away. Anti-nausea medications, no. Sancuso, Satuso, Reglan, Inosapane, Zofran, Zuplex. No, I don't take any of those. Linezolid, Zovax antibiotic, Retinovir, an anti-retinivir medication used to treat HIV. I don't have HIV, so I don't take that. Risk factors. Okay. Some people are more susceptible to drugs and supplements that cause serotonin syndrome than others, but the condition can occur in anyone. You're at increased risk of serotonin syndrome if you recently started taking or increase a dose of medication known to increase serotonin levels. You take more than one drug known to increase serotonin levels. Okay, so yeah, we kind of went over that. Okay, there's a whole lot of stuff here. Herbal supplement, you take herbal supplements to increase serotonin level. Use an illicit drug known to increase serotonin level. No, as I said, I don't take drugs, illegal drugs. Complications. Serotonin syndrome generally doesn't cause any problems once serotonin levels are back to normal. So that's what they did in the hospital. My serotonin was way up, and they got it back to stabilize, and that's why I was able to go back home. If left untreated, severe serotonin can lead to unconsciousness and death, and that's why I was hospitalized. But I have problems the way everything was handled, but it had to be done, but things could have been done differently. Prevention. Taking more than one serotonin related medication or increasing your dose of a serotonin related medication increases your risk of serotonin. Be sure to talk to your doctor or your family member, or if you or your family member has experienced serotonin symptoms after taking a medication. Also talk to your doctor about possible risks. Don't stop taking any medications on your own. If your doctor prescribes a new medication, make sure he or she knows all the other medications you're taking. If you and your doctor decide the benefits of combining certain serotonin levels affecting drugs outweigh the risk, be alert to the possibility of serotonin syndrome. And this was all put together by the Mayo Clinic. I think that should be about it. Let me just look at my last page here. Yeah, that's it. Anyway, this has been a long-winded thing, but it was a nightmare for me last week. Anyway, if you like all these podcasts, be sure to hit the subscribe button and the bell notification. If you're listening to this on my YouTube channel, be sure to check out my other channels too. My cat channel, All About Job, and my Karl's Corner podcast. This goes directly to my YouTube channel there. But yeah, I'm going to talk about what happened, what I liked, what I didn't like, and that sort of thing in the following podcast, one or two podcasts, because there's a lot of things that I was very unhappy about. But I do agree that I should have been to the hospital, but the way I was transported to the hospital, that's for another show. Stay tuned for that. We're going to talk about that next time. Well, I'm going to end with my music here. Okay, well, talk to you next week, and have a good day and stay safe. And if you have any symptoms, be sure to contact the appropriate physician.